Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. We had last week off, and so it's good to be back with you again tonight. It looks like we have a little bit of a lighter turnout than typical. Probably people are listening in to see what happens with the U.S. election here tonight. But we're still going to have a webinar, and we're going to talk about Lyme disease. So as many of you know that have been here before, you create this webinar with your questions. You can participate in two ways. One is write a question. Second way is to just listen to the responses. Usually with questions, I use it as a platform to explain a lot of different things, okay? So the way that you can write a question to me is over on the right-hand side of the screen at the bottom, there's a chat box. Write your question to me through there. The only thing I ask is do not hit the enter key until your whole question is written. If you do hit the enter key as you're writing the question, it actually sends multiple pieces of your question to me, and it gets hard for me to piece it together from my side. I am creating a recording of tonight's webinar, and we'll be sending that out tomorrow morning, or notification about it being complete tomorrow morning through the email. And so look for that probably around 9, probably around by 7:30 to 8 in the morning. I should have that done. And then with that email, you'll be able to sign up for next week's webinar as well, too. So we're doing 3 in a row tonight, the week after, and the week after that. If you do find value from these, I ask that you actually spread the word. If you know there's other people with Lyme that may benefit from participating in these webinars, feel free to share those emails when I send them out in the morning, and also the ones that I send out announcing that a webinar is going to be held too. All right. So during the webinar tonight, I will be showing the questions on your screen for those that are participating in the live version. But because a lot of people don't participate in the live version, they still watch the video recordings, I will also read those questions because the questions don't show up on the screen in the recorded version. All right. So without any further ado, let's go ahead and get started here. All right. Hello, Bill. Let's see. Hello, Dr. Ross. You have stated that cytokines from a yeast overgrowth can mimic clinical signs of Lyme and Bartonella. Does that include cardiac arrhythmias and neuropathies? So what I have said, as many of you know, when you have Lyme, one of the reasons that you have a lot of symptoms is the immune system reaction to having the germ in you. So white blood cells, when they see an infection, some of those white blood cells will manufacture some chemicals called cytokines. All right. The cytokines are good and bad. On the good side, they cause more white blood cells to be made. They draw those white blood cells to where the infection is, and they help those white blood cells work better. Those are all good things. The trouble in Lyme, and if you have mold toxin illness, and if you have too many yeast in you often, is that the immune system doesn't do a good job getting rid of these problems, but it keeps trying harder and harder, and it tries harder and harder by manufacturing more cytokines, all right? So you get into a situation where you can have cytokine excess. And cytokines lead to many of the symptoms that people have when they have Lyme disease. So the major symptoms of cytokine excess are thinking problems, fatigue, body pain. You also can get sleep disturbances. Those excess cytokines can give mental health problems as well, too. Okay, those are the predominant symptoms, all right? So yeast, mold toxicity, and Lyme can cause all those. And I think I mentioned body pain and joint pain in there too. All right. Now, in addition, each of these infections can have some other problems that occur with them too. So having too many yeast in you does not directly result in heart rhythm problems. And cytokines probably are not what trigger heart rhythm problems. Those are probably caused more by Lyme infecting the conduction pathways in the heart, okay? Neuropathy, although increased cytokines will sometimes bring out more neuropathy, sometimes when you have too many yeast in your intestines, the reason you get more neuropathy probably relates to the fact that yeast also release toxins. And those toxins can get absorbed into the bloodstream, and they sometimes can irritate the nerves. So they can be neurotoxins, basically. All right. So to answer your question specifically, no, I would not think of cytokines triggering cardiac arrhythmias. And cytokines, although may make an underlying neuropathy a little bit worse, the thing that can happen with yeast is that yeast releases toxins that can act as neurotoxins that can bring on some of that neuropathy a little bit worse too. Okay? All right. So, Bill, thanks for that question. Actually, I'm just going to do a quick screen share here, everyone, show you something to take a look at. So let me do that. Okay, so let's see here. Okay, so this is my Lyme disease information site, Treat Lyme by Marty Ross MD. Take a look here at this chapter called Herxheimer and Cytokines. And I've got a very comprehensive article about cytokines and approaches you can take to lower them, all right? Because one of the problems you run into with cytokines is although they give you a lot of symptoms, the other thing that they do is they can suppress the immune system if they get made in excess. So in this article, I talk about various steps you can take to lower those cytokines, okay? I build some of these cytokine lowering steps into my Lyme disease treatment protocol, which you'll find here, the Ross Lyme support protocol. And you'll notice that and these are key steps you should take in your treatment, like get sleep, okay? Getting sleep lowers cytokines, all right? So that's one of the reasons you want to get sleep. The other thing, though, is there's things you can take to lower those cytokines. And I build that in as the third part of my Lyme treatment protocol, okay? All right. Thank you for that question again. Hello, Sarita. Let's see. Hi, Dr. Ross. What is your protocol for people with chronic co-infections and Lyme who become pregnant? Is it the same protocol for active versus in remission? Do you see a lot of babies being infected by mothers? Is it spread through breastfeeding? Thank you. All right. So let's talk about this a little bit. So when it comes to Lyme and co-infections, the amount of research that's out there is very limited about transmission. All right. Same with breastfeeding. So let me tell you what we do know. So when it comes to the Lyme germ, not babesia, not Bartonella, but the Lyme germ, the best information that we have about transmissibility comes from a data bank that was kept out on the East Coast in the late 80s and early 90s, where women that had Lyme allowed information to be collected about them and their babies, right? And what we saw from that pregnancy registry is that around 50% of the time that a woman had Lyme and was not treated with antibiotics during her pregnancy, the Lyme germ would transmit to the baby. 50%, okay? The difficulty is in that study or in that data bank, there was not information kept about Bartonella and about babesia, all right? Now, there's some very limited science that suggests, but it's not conclusive, that when people designed research projects that look to see can Lyme be transmitted during pregnancy, in some of those studies, there's some information suggesting it can be, but it's not solid scientific research evidence, right? For Bartonella, we have no science that proves it is transmitted during pregnancy. We do have anecdotal reports among various physicians that have treated women that have Lyme about the possibility of it being transmitted, but we don't have solid proof on that. For babesia, the majority of studies that have been done looking at this suggest it is not transmitted during pregnancy, but there are some providers who think it is based upon anecdotal, meaning evidence that they have from somebody in their practice possibly sending it to the baby, okay? So if I had to rate this all out, I think we have the strongest evidence suggesting Lyme transmission. We have no evidence suggesting Bartonella, and we have limited to no evidence suggesting babesia can be transmitted. Right? What do I think? I think, based on what I've seen in my practice, Lyme can be transmitted. I think Bartonella can be transmitted. Babesia, I don't think it is. Okay? All right. Now, in terms of pregnancy then, in terms of preventing Lyme, there's some things that I will use on my patients. Number one, there's 3 antibiotics you can use to prevent transmission. Those are either azithromycin, cefuroxime, or amoxicillin. And the dosing you can find in my article about how to prevent pregnancy transmission, okay? When it comes to Bartonella, there is the possibility that azithromycin that you can also use to treat and prevent transmission of Lyme, azithromycin is a treatment for Bartonella that could prevent transmission of it as well too. It is also possible and safe to use another antibiotic during pregnancy. If you have raging Bartonella and your Bartonella needs to be treated, another antibiotic you can use in pregnancy that would still be safe to the baby would be to take a combination of azithromycin and rifampin. Those could both be used during pregnancy. You'd have to have monitoring done as well, okay? All right. And then when it comes to babesia, my understanding, although I've never treated somebody with babesia during pregnancy, I believe that atovaquone, which is Mepron, can be used during pregnancy. Keep in mind, you cannot mix your atovaquone with rifampin that I just mentioned for Bartonella, okay? In terms of Lyme and co-infections being spread by breastfeeding, there's no evidence about babesia. Bartonella, I have not seen any evidence suggesting it. In terms of Lyme, there is no science that proves transmission in breast milk. However, there is science that does show that it is in the breast milk. And so you have to wonder, could it be transmitted that way? The argument against it being transmitted is that when a baby drinks your breast milk, even if it has Lyme in it, the acid of the stomach most likely gets rid of that Lyme. So I think that the ability of any of these germs to be transmitted by breastfeeding are quite small. As an added precaution that you could do is if you are on one of these 3 antibiotics I mentioned earlier, the azithromycin, cefuroxime, or amoxicillin, as part of breastfeeding, that probably stops transmission by breastfeeding, okay? Let's see here. Yeah, so those are my ideas for you, okay? All right. Let me do a quick screen share on one part of what we just talked about here, Sarita. Oh, in terms of doses, in terms of azithromycin, 500 milligrams a day. Rifampin, I would dose at 300 milligrams, 2 pills, 1 time a day. Cefuroxime, 500 milligrams, twice a day. And amoxicillin, 500 milligrams, 3 times a day. The Mepron, atovaquone, I would have to look that up. Again, I don't know for sure about that in pregnancy. I'd have to look at it a little bit more in terms of what's the recommended dosage during pregnancy. But I do believe from some of the workshops I've been in before where people have talked about it, that atovaquone, Mepron could be used. I just don't know the correct dosing for pregnancy, okay? All right, let me do a quick screen share here. All right, so if you're looking for information about the Lyme germ in pregnancy, take a look at my pregnancy chapter here. I talk about various things to do during pregnancy, including which antibiotics to use. You can look at it right here in this article, okay? All right. Thanks for the question, Sarita, and good luck. Hello, David. Let's see. What do you recommend as treatment for extreme high levels of zearalenone? I am currently taking activated charcoal, metaclay, and modified citrus pectin for aflatoxin, ochratoxin. Do you recommend any additional supplements or binders for the zearalenone? You know, I have not seen anyone specifically identify in any research what is the best one to use for that toxin. What I do when I have that toxin is I like to use a combination of activated charcoal and metaclay or bentonite clay. And I find that that combination has worked well in my practice clinically to get rid of those toxins, okay? So that's what I would do. I don't think you necessarily need to be on the modified citrus pectin. However, it probably could give some benefit as well too, all right? So everyone, David's talking about mold toxin illness. And there's about 25% of all people that have a genetic predisposition where when they get a mold toxin in their blood that they breathe in from their environment, that those mold toxins get trapped in the blood because genetically their immune systems are not set up to break down, identify those mold toxins and break them down. Okay, so we have to remove them, and we use a process of using binders to get them out. Different toxins like ochratoxin and aflatoxin, we know from research what are great binders for them. I just haven't seen exactly what it is for the zero linone that you have, okay? Let me show everyone a quick screen share. If you want to read more about what specific binders you use for which toxins and you want to see more about mold toxin illness, I'm just going to do a quick screen share here again. All right, so take a look at my website, take a look in the detoxification section. And in terms of the Lyme mold toxin illness, take a look at this article right here. All right, David, thanks for the question. Hello, Laura. Say hi, Dr. Ross. My 24-year-old daughter has had Lyme, babesia, and Bartonella for 9 years and was treated by LLMD in Maine for 2 years until COVID shut down the border in March of 2020. A Canadian migraine neurologist has offered Botox in her head and neck to reduce near constant migraines. Do you know what the risks are? Thank you for sharing knowledge so generously. So, I have a number of patients in my practice that have received Botox injections for a variety of reasons, one being chronic pain and chronic migraines like you're suggesting here. I have not seen any complications occur from that. I have not seen Lyme get worsened by people using Botox. I have not seen any additional risk of getting Botox than anyone would have from getting Botox in any condition, okay? So I do recommend Botox injections for my patients because sometimes it's the only thing that gives them relief, and I have never seen adverse outcomes in terms of the Lyme germ or Lyme and co-infections when somebody gets Botox injections, okay? All right. Thanks for the question, Laura. Good luck. Well, good luck to your 24-year-old daughter. Hello, Crystal. Hello, Dr. Ross. Question. I'm taking Rifampin as part of Bartonella treatment. My liver enzymes increase when I take 300 milligrams 2 times a day. Rifampin is the only drug that helps with my symptoms, so my MD put me on 150 milligrams 2 times a day. My enzymes went back to normal. Unfortunately, this dose is not strong enough. My BART symptoms are back. If I divided a 600 milligram dose of Rifampin, which gave me symptom relief before, into smaller doses throughout the day, would this put less burden on the liver? For example, if I took 150 milligrams 4 times a day for a total of 600 milligrams, would my liver be able to tolerate it better? And second question, how useful is ivermectin in the treatment of Lyme, Bartonella, babesia, etc.? Do you find it useful in your practice? Thanks for your help. Be well, Crystal. Okay. Second part of that question, the ivermectin, I have not found it to be useful for treating Lyme, Bartonella, or babesia. It's not part of my protocols. I sometimes will use ivermectin if somebody has intestinal parasites based on testing that says that would be the best agent for them, but I don't use ivermectin on any regular basis in my practice. In terms of the Rifampin, so the problem with Rifampin is it turns on certain liver enzymes, all right? And the effect is ongoing. So spacing out your medicines is not going to give you any added benefit in terms of turning those liver enzymes on. It just won't. What I will do in situations like this, I want to just talk to you about liver enzyme elevation. I accept that Rifampin is going to lead to some liver enzyme elevation. So those enzymes are called AST and ALT, and some doctors get very concerned if those become elevated. The problem when you get into liver inflammation, which AST being elevated and ALT being elevated says you got liver inflammation. is if you let liver inflammation go on too long, it could lead to scarring of the liver. And that's a condition that we ultimately call cirrhosis of the liver. If you get extensive scarring of the liver, it actually squeezes out the healthy functioning tissue, and you start being unable to detox the things you need to remove, and you lose good liver function, okay? But having said that, you don't just suddenly get a lot of liver inflammation and then have it turn into scarring, meaning you could have low grades of inflammation for a year, 2 years, 3 years or more, and it will not result in any scarring, all right? So it's okay to let your liver enzymes become somewhat elevated. And so what my standard is I allow my liver enzymes in my patients on rifampin to become elevated as long as they don't go over 2 times the upper end of normal. So for instance, depending on which lab system you use, they all report slightly different ranges here, but a typical AST level in some labs would be between 20 and 40. So the upper end of that normal range is 40, and I allow my enzymes to go up to 2 times the upper end of normal. So I would be okay if I can keep that AST at 80 or lower. Again, the normal lab range would probably be 20 to 40, depending on whose lab system you use, okay? So you always have to look at the upper end of normal, and you want to keep within 2 times the upper end of normal. If I do that, I've never found anyone developing long-term problems from doing that, okay? Now, what I will do sometimes when my patients are on rifampin and they're getting excessive liver enzyme elevation is I will do things to support the liver. And what I have found very helpful is supporting the liver and allowing them to keep taking their rifampin, for instance, is to use lots of glutathione. And I like using liposomal glutathione, and I like using that as a product made by research nutritionals called Trifortify Orange or Trifortify Watermelon. Liposomal means it's glutathione that's microscopically wrapped in fat to increase absorption. And then what glutathione is the master antioxidant made in every one of our cells to repair damage. And if your liver is inflamed, it's damaged and it needs to be repaired, okay? Now, the thing is if your liver is constantly repairing itself, it will eventually exhaust its own glutathione supply and be unable to keep up with the repair. So you need to put more in. You need to fill the gas tank back up. So I like using the Trifortifies by research nutritionals because they have got good science that shows they have good absorption. And I like people to take 400 to 500 milligrams twice a day if they have a lot of liver inflammation going on. Okay. If you're using it mainly just to prevent liver inflammation, you can use it 1 time a day. And what 400 to 500 milligrams is a teaspoonful of the Trifortify product. And again, you would do that up to 2 times a day if you're having liver inflammation. Okay. All right. So good luck to you, Crystal. Thanks for that question. Hello, Heather. Let's see. Thanks for doing these. You're welcome. Let's see. I was just diagnosed with Ehrlos syndrome at a dysautonomia clinic. I've noticed this illness is supposed to be very rare, but is frequently talked about in the Lyme community. Is it caused by Lyme? My doctor said my type of Ehrlos is associated with POTS and mast cell activation syndrome. Now I'm wondering if I should stop treating Lyme. Any tips on dealing with chronic neck pain? All right, so in terms of Ehrlos syndrome, basically it means that you've got, and the end outcome of Ehrlos syndrome is you've got lax joints. The tissue that is supposed to hold your joints together is stretchier than normal. Okay, and that's all. And so what holds your joints together are the ligaments and the tendons. So ligaments are fibrous tissues that connect bone to bone. They hold one bone that's attached to another bone together. And then tendons would be that real fibery substance that holds a muscle to a bone, okay? And so with Ehrlos you can get stretching out of those connective tissues in the tendons and the ligaments. And so I have seen that occur in Lyme. I think it happens to a degree that makes me think Lyme could, in some situations, either make the underlying condition worse or be a cause of it. And so what can happen with Lyme is Lyme likes to live in tissues that don't have good blood flow. And so it will sometimes make enzymes that break tissue down, like the connective tissue, the fibrous substances that are supposed to hold your joints together. Okay, so Lyme could be a cause of that, or it could be making an underlying condition worse. Lyme also can trigger POTS, and Lyme can trigger mast cell activation syndrome. Okay, so I probably would keep treating your Lyme, and then do other supports for the POTS and for the mast cell activation. Okay, let's see. I wonder if I should stop treating. No, I keep treating actually. And then any tips on dealing with chronic neck pain? So for chronic neck pain, I like working with anti-inflammatories, and I like working with anti-inflammatory herbs, actually. So I would do some Mariva 500, which is a product by Thorne that is liposomal curcumin, 500 milligrams 3 times a day. Can be helpful to get inflammation down. Can be helpful to get cytokine inflammation down specifically, okay? The other thing that you can do that can be helpful for neck pain is to get acupuncture. Can sometimes be quite helpful. I've had patients get relief with that. There's an occasional patient that will get relief using even using chiropractic. Although if you have Ehrlos Danlos, I would not do chiropractic. I think your tissues would be too loose and it'd be hard to handle the manipulation actually. Oh, magnesium is another thing you can try. It helps relax the muscles around the neck. If you're to do that, I would dose anywhere from 400 to 600 milligrams of any type of magnesium, like a magnesium malate or a magnesium citrate. Any of those would be useful at relaxing the muscles, okay? If you start getting too much magnesium in you, it can lead to diarrhea, all right? So if that happens, then you just back down the amount that you're taking at nighttime, okay? Oh, the reason I have people take it at bedtime is that it can make you sleepy at that dose. All right. Thanks for that question, Heather. Hello, Doug. Let's see. I've been taking Ceftonir since July 1 and then doxycycline for over a month. I started taking Biocidin yesterday and I think I see where the second part is here, and am experiencing severe brain fog. Is Biocidin that potent? Yes, yes, it can be. So Biocidin is an herbal complex. It has a variety of herbs in it that have been studied to see what their effect would be in Lyme. Now, these are laboratory experiments, but in laboratory experiments, it breaks down biofilms that protect Lyme from the immune system and antibiotics. Okay, so it cleans away those biofilm slime layers. All right. It also is directly has the ability to directly kill Lyme germs. Some of the herbs in it are shown to decrease Lyme's ability to resist antibiotics. So the answer is, yeah, you can get some strong killing from this. I have seen patients that I put on Biocidin get Herxheimer reactions that are quite strong. Okay. So yeah, that's very possible. All right. So for those of you that want some more information about Biocidin, what's in it, and specifically what the research says about it, take a look. I've written an article about it. So this is my article, Biocidin, a potent antimicrobial and biofilm breaker. There's a variety of Biocidin products. And in this article, I review them. And I even suggest what's the best way to take it and for which conditions you might want to use it for. Okay. So it helps Lyme. Also might be used successfully to treat SIBO, which is small intestine bacteria overgrowth. You can use it as a biofilm breaker. And it also has some anti-yeast abilities and properties as well, too. All right. All right. Thanks for the question. Hello, Loda. Let's see. Hi. I took disulfur for 3 months. and felt a lot better, but got terrible pain under my feet. I stopped taking disulfiram a year ago because of the foot pain, but the pain is still there. What should I do now? Loda, I guess I would want to know a little bit more about your pain, the quality of that pain. So for instance, if the pain is neurologic, and neurologic pain has the following qualities: sharp or stabbing or piercing or burning or electrical or zapping, that's nerve pain, okay? If it is that you've got achy pain on the balls of the feet, then I'm going to want to also consider, do you have other symptoms that we sometimes see in Bartonella? Because sometimes achy pain on the balls of the feet is also a sign that you could have Bartonella. All right, now, just because you have achiness on the balls of the feet does not mean you have Bartonella, but you need to look and see, do you have a lot of the other symptoms that are suggestive of Bartonella? So in a second here, I'm going to show you my article about how do you diagnose Bartonella. So it could be Bartonella if this is non-neurologic pain. If this is neurologic pain, one of the things that could have happened is disulfiram can lead to neuropathy. And although for most people that have had disulfiram, the neuropathy goes away once you stop taking the disulfiram, there's a small percentage of people that it does not. It stays on. So if you have neurologic pain, then you need to start doing nerve repair, okay, and to get rid of that. And so for nerve repair, I like doing I'll show you, there's an article I have about that, okay? So first of all, let me just show you a couple of these articles and I'll walk you through how to do nerve repair if that's what you have. All right, so I do a quick screen share here again. Okay, so first of all, about, I think almost a month ago now, I republished my article about disulfiram, okay? And so this is it. And in here, I review the possibilities of getting side effects, including data that shows that 14.9% of people get neuropathy on disulfiram. Okay. All right. So I just want you to keep that in mind. Okay. All right. Then, so that's an article to take a look at. I review the odds that disulfiram will work plus the odds of getting various side effect problems. All right. I talk about foods to avoid. I talk about how to use disulfiram extensively in this article, okay? All right. Many of you know disulfiram is the drug we're using now to treat persister Lyme, okay? And I review when and why you would use it here. This image here is actually the image, the picture of what the chemical structure of disulfiram looks like. All right. Now, let's see here. What else did I want to show you here? All right. So in terms of doing how to diagnose Bartonella. That was the other thing. So take a look at my section here called How to Diagnose. And this is the article on how to diagnose Bartonella and chronic Lyme disease. Most of the diagnosis, if not all, is based on symptoms. Click on this article and I give you the whole list of symptoms to consider if you might have Bartonella. All right. And then in terms of repairing neuropathy, if it is nerve pain that you have, take a look at my section on brain and nerves here, and then take a look at this article on neuropathy repair. All right, and in here, there's some basic steps. One thing is you need to do steps to repair the nerve cell membrane and your mitochondria energy factory membranes. When you have neuropathy, you probably have injury of the cell energy factories called mitochondria, okay? And so one of the things you want to do is fat repair of the cell membrane, the mitochondria. In here, I talk about the various supplements that will do that right here, okay? The other thing you want to do is increase glutathione. We already talked about glutathione earlier tonight. It's the master antioxidant that fixes damage, and you want to supplement that. I talked to you about how to do it here. And then you may want to consider using CoQ10 and something called acetyl L-carnitine, and I talk about it here as well too. Finally, if it is nerve inflammation, make sure you're using curcumin as your anti-inflammatory. That's the Mariva 500 that I talked about earlier, okay? All right, good luck to you. Hello, Lewis. Let's see. Hello, Dr. Ross. Thank you for all your work. You're welcome. Let's see. These webinars are useful. I'm glad you find them that way. Let's see. I read in a study that doxycycline is helping against the growing form of Lyme, but might cause more persister forms, and doxy persisters are difficult to exterminate. In the same study, it is shown that tinidazole can help reduce by more than 90% the persister. I know some LMDs use rifampin and doxy to treat Lyme, probably based on Horowitz's research. Is it a good idea, knowing it can cause resistant persisters? Why not use another antibiotic with tinidazole? Second, which is better, tinidazole or metronidazole to treat Lyme? Okay. So let's talk about a few things here. I'm not sure what study you're looking at, but I want to clarify terms. So first of all, Lyme exists in two forms. Okay, there's something called spirochete. That's the corkscrew-looking thing that you see under the microphone. If you Google Lyme spirochete, you're going to see it. It's the image that everyone shows. It's this corkscrew-looking thing. Okay, that's called the spirochete. In addition, we think the spirochete can morph into a different form, which is called a cyst form of Lyme. Okay, when the spirochete is under stress, it may switch over to the cyst form of Lyme. Right. Then there's two different growth states. All right. So there's forms, spirochete and cyst, and then there's growth states. The two growth states are growing and persisting. Okay. A persister form of a germ, or the persister state of a germ, means the germ has gone into hibernation. It's slowed its metabolism way down, and it ignores everything, including antibiotics. Okay. So you can have growing spirochetes and you can have persister spirochetes. You can have growing cyst and you can have persister cyst. Okay. Now, when it comes to things that we can use to treat spirochetes and cyst, doxycycline is a great anti-spirochete medicine, but it may trigger more cyst to develop, the cyst form. Okay. So usually when I put somebody on doxycycline, I also want them on something that's going to treat the cyst form. So things that you can use for cyst are rifampin. So that's part of the Horowitz protocol, okay, but it can treat cyst, okay. You could use the herb grapefruit seed extract, 250 milligrams twice a day, or you could use a metronidazole, or you could use a tinidazole, okay. All right, you can use any of those, all right. The tinidazole has research showing, these are studies that were published by Eva Shapi, that's SAPI, out of her Lyme Research Lab in New Haven, Connecticut. She was the one that did studies, and I think that's the study you're talking about. Her studies show that doxycycline promotes cyst formation. She didn't use the words persister in that study, if that's what I think you're looking at, okay? But cyst formation. And she showed that cyst can be broken down by tinidazole and metronidazole. She also showed that tinidazole can break down biofilm slime layers that cover the Lyme germs as well too. Okay, all right. In terms of what's a better biofilm breaker, according to Eva Shapi's research, tinidazole may be a better biofilm breaker than metronidazole. In terms of ability to kill cyst forms of Lyme, tinidazole and metronidazole are the same, based on her research, okay? Now, if I'm looking at using something that will treat cyst Lyme and break down biofilms, I will choose tinidazole over metronidazole. I will also choose it over rifampin, and I will choose it over grapefruit seed extract, okay? All right, then, persisters, there is no science that says tinidazole or metronidazole treat persisters. So again, persister is one of the growth states where it's not growing, okay? The research we have about that comes out of Stanford University by Dr. Rojadas in his lab, where we saw that disulfiram can treat persister forms of Lyme. His research lab, I believe, also in that same study showed that ceftonir actually is something that can treat persister Lyme. And I'd have to go look at the research article to see what other things might treat persister growth state of the Lyme germ, okay? All right. And then the other lab that's done a lot of research looking at what do we use for persisters is the Johns Hopkins lab, Ging Zhang's lab. And in his studies, I haven't seen him use tinidazole or any of these azoles to treat persister forms. Okay. All right. So I think I answered your question. Let me just look back through here again. Yeah. So yeah, I think doxycycline is good to use as long as you're doing things to take care of the cyst form of the germ. And then I will also tell you, I know that the current world's abuzz with everything about treating persisters, right? Because we now know Dapsone helps get works effectively in about 39% of people to deal with their persisters. But before we knew about persisters, we still got people well by not ever putting them on anything for persisters, okay? So it still begs the question with most people, do we have to put people on something to deal with persisters? All right, keep in mind these persisters are being created in the lab. Just because we're seeing them in the lab does not mean they're actually a state that occurs in everybody that is living that has Lyme. All right, yeah, we can create them in the lab, but we still don't know, are they really significant in everybody that has Lyme? We honestly don't know that, all right? And it's also not clear that just because we know they can develop, do we really need to do everything about them in every person? Because for years, I've been treating people for Lyme, getting people well, and never doing anything to treat persisters. So we're still trying to figure out what is the meaning of this laboratory research that says persisters. And we know that the way some people are responding to disulfiram, that probably for some people, persisters are their big problem. But it may not be that it's a big problem in everybody. Okay. All right. Thanks for the question, Lewis. Hello, Kathleen. Let's see. I was given the Lyme IgG immunoblot blood test, Borrelia B31 and Ops A, IG virus stripe, IgG in April. I was positive for these bands, 93, 66, 58, 41, 39 bands, 93, 58, and 41, far exceeded the CDC cutoff. Intensity and others were very close to cutoff. Yet I am considered to be Lyme negative. I have IgG co-infections, Epstein-Barr, HHV6, mycoplasma pneumonia. I also have symptoms of dizziness, head pressure, neck pain, twitching inside calf, muscle spasms in feet, tinnitus, arm pain, pain in the feet, and arthritis in toes and fingers. In your opinion, would you consider me Lyme positive? What is a typical regimen for such a scenario? All right, bear with me. Okay, so your IgG, it looks like, was positive at 93, 66, 58, 41, 39. Okay. So there are alternative diagnostic criteria in how you evaluate a Western blot like you've had. All right, so the protocol I use and even IGenex uses in the interpretation of their Western blot is that we look to see if you have antibodies against 2 of the following 6. And if you have antibodies against 2 of these following 6 bands, that technically is a positive test. Those 6 that we focus on are the 8393 protein, which you've listed as a 93 here, okay? Proteins 23-25, which is one protein that will either be reported as 23-25 or 23, depending on which product you're using. Band 31, band 39, and band 41. All right, so 23-25, 31, 39, 41, 83-93. If you are positive against at least 2 of those, that constitutes a positive test. You were positive against at least 2 of those. I would call that a positive test. You've got a lot of symptoms that also fit Lyme, okay? So the way we consider making a Lyme diagnosis is we look at a few things. Number 1, is there a risk that you got bit by a tick, or did you actually get bit by a tick? Okay, so if you don't remember a tick bite, 50% of the time that people have Lyme, they don't remember tick bites. But if you don't remember tick bite, then we start thinking about, did you do activities that might have put you into a place you could have run into a tick, okay? So do you live in New Jersey where 95% of ticks are shown to carry Lyme? Just living in New Jersey puts you at big risk, okay, of being bitten by a tick that you didn't remember being bitten by, okay? Are you a hunter? Do you do a lot of backpacking? Okay, so we consider things like that. All right. In addition to looking at risk, we consider what do your symptoms look like. Yeah, those look like Lyme symptoms to me. Third thing we look at is, are there any physical exam findings? And the fourth thing we look at is, do you have a supportive test? And in your situation, I would say, yeah, you have a supportive test. Okay, so I would call that Lyme. Now, I can't diagnose you here. I'm just saying, based on what you wrote, I would call that Lyme. Now, what do you do to treat it? Well, take a look at my Ross Lyme support protocol. I've given you some initial steps on how you can treat it with prescription or herbal antibiotics. And that's you'll find it under my treatment protocol arm. Okay. All right. Thanks for that question, Kathleen. Good luck to you. Hello, Jen. Let's see, Dr. Ross. I have two questions. One, you spoke about a strategy to use for those who require retreatment with disulfiram. You suggested combining disulfiram, which targets persister forms of the Lyme bacteria, with doxycycline, which targets growing form, and grapefruit seed extract, which targets the cyst form. Can you explain why you feel that doxycycline and GSE are the best options? Are there any other alternatives? And two, I heard Sam Donta recently suggest that supplementing B vitamins for those being treated for Lyme disease might be a mistake, given that Lyme bacteria are unable to manufacture the Bs and must get them from their host. What are your thoughts on this? Thanks so much for doing these webinars and for all you do to help those with Lyme and co-infections. Okay. So yeah, my comment about any nutrient, whether it's magnesium, sugar, B vitamins, etc., the germs that live in us, that are designed to exist in us, are going to live on the same things that we need. Okay, they're parasites in a sense, right? They're gonna thrive in environments that we thrive in. All right. So I take a viewpoint that, yeah, I see these studies that say magnesium causes Lyme, and that possibly B vitamins make Lyme worse, and I don't buy it, because you can't. And here's why. Yes, in a lab that may be true, but we also need things to function ourselves too. And we can't starve us to starve the germ. We can't harm ourselves to starve the germ. And of course, Lyme thrives with B vitamins. And of course, Lyme thrives with sugar. And of course, Lyme thrives with magnesium. Lyme lives in us, and we thrive with magnesium, and we thrive with sugar, and we thrive with B vitamins. So I take a judicious use, Rosto, use those supplements. I am aware of science that says you need to be careful, but I still use them, because I think ultimately we need to support us and our immune system's ability to get rid of these things. And our immune system does better if we do that kind of vitamin supplementation. Okay. Right. Number two, in terms of my point, I was saying that regarding disulfiram, we know from science that it treats those persisting growth states of the germ. The science was done looking at persister. Okay. The science was not done looking at what about growing forms, or the growing state of spirochetes and growing state of the cyst. So we don't know, based on science, whether they actually treat the growth forms of spirochetes and the growth forms of cyst. We have no evidence of it. Okay. Now, having said that, I've got one person in my practice that came in and said the only thing she ever wanted to be on was disulfiram. When I offered her, and she was new to treatment, she had never been on an antibiotic before, either herbal or prescription. She had had Lyme probably for a good 20 years, and she wanted to try disulfiram. And I said, we're using it mainly for people that have failed antibiotics. There is limited research to suggest that it is, or we have no research that says it's the first thing you give somebody. All right. We're not clear about when is the best time to add it. Do we add it right at the beginning of treatment? Maybe. Should we do more to take care of a growing spirochete and growing cyst first? Perhaps. All right. So I told her we just don't know. Most of the research we have that many of us are using to look at using disulfiram is based on people that have been treated for long periods of time with antibiotics that didn't get well And then we put them on disulfiram, all right? So keep in mind that by the time most people that are being put on disulfiram, that many physicians like Dr. Liegner and I are doing, most of those people have already done years of antibiotics treating growing forms of spirochetes and growing forms of cyst, okay? All right. So my comments were is if you've treated with disulfiram and you did not get better or it doesn't last, part of the problem may be is that you needed to address the growing forms of spirochetes and the growing form of cyst, knowing that disulfiram probably takes care of the hibernating forms of spirochetes and the hibernating forms of cyst, and we call those hibernating forms persisters, okay? So you can make an argument to treat growing spirochete and treat growing cyst, all right? And one way to do that is doxycycline grapefruit seed extract. That's one way to do it. You could also use clarithromycin as something that treats growing spirochete, and you could use metronidazole to treat the cyst, okay? So my point is that you need to be on something that treats spirochetes and cyst that are in the growing form. I have an extensive article about how do you treat spirochete and cyst. That's how we design Lyme treatments, and that's my Lyme disease antibiotic guide. So if you're looking for options, in addition to doing doxycycline and grapefruit seed extract, other ways to do that, I'll show you what that article is, but look at the options I have for treating spirochetes and cyst in that my Lyme disease antibiotic guide, okay? All right, so let me do a quick screen share here. All right, so take a look at my infection treatment plan section here and take a look at my Lyme disease antibiotic guide. And then in here, I review the various antibiotics we can use. And then I also talk about combinations that you can use that treat spirochete and cyst. So you could do like an azithromycin along with flagyl, for instance. Or you can use doxycycline coupled with grapefruit seed extract. Anyhow, I go through different options here. Take a look at that, okay? Thanks for your question, Jen. Good luck to you. Hello, Jen, again. Let's see. Can you tell us your thoughts about the recently published Dapsone study? So Horowitz is the author of the Dapsone study. There was one that he published around 2 or 3 years ago, and which looked at, he studied 100 people to see what would happen if you put them on Dapsone, and in that the dose ranged up to 100 milligrams. In that study that came out, I think it was around 3 or 4 years ago, Horowitz did a great job of promoting the idea that Dapsone is a great treatment for Lyme, but he over-promoted it based on what the data tells us. I just want you to know that. Dr. Horowitz is a great promoter of his work and his perceived benefit, but we have to look more at what the data told us. Okay, so in that study, the data said that around 50, I think it's 54, 55% of people got benefit. That means that 36, did I do my math right? That means that 45% of people or so did not get benefit, and a large chunk of those could not stay on it because they couldn't tolerate it. Okay, all right. So Dr. Horowitz didn't do a lot of talking about those numbers. Okay. The other thing that happened in the Horowitz study from those 100 of people that used it is that if we go through and we look at the charts in his study, the average degrees of improvement ranged from about 11, I think around 10% up to 20%, with I think it was an average of about 15%. So although people get benefit, it's a 10 to 20% improvement. It is not a miracle drug, okay? And yet, if you listen to Horowitz back then, he was touting it as the thing that was going to save the world of Lyme. And he still touts it that way, okay? Now, there is a more recent study that he looked, I believe, published about the effects on 200 people that he's treated, and some but that was it. It was still, I think he still was at the 100 milligram dose in it. Actually, I need to go back and look at what the most recent one looked at. The point I'm trying to make is Dr. Horowitz does a great job of promoting his Dapsone, and he's come up with a newer way of using it, which goes from up to 200 milligrams, very high dose Dapsone. The real problem with Dapsone, though, is that a lot of people just can't tolerate it. It's just an extremely harsh medication. And if you happen to be one person that can get up to the 200 milligram dose, it is possible you can put your Lyme into remission, but the majority of people can never get there. It's a very hard to take medication. Okay. I'll show you an article I've written about it so you can take a look at that more. In terms of what you're calling the recent study, I would need to know what the date is on that, because there is the older one that's a 3 to 5 year old study, I believe. And then within this year, he talked about further results on, I believe, 200 people. And I believe in that study, he did not go over the 100 milligrams in that. I don't think he's published a study yet about the 200 milligram, unless I missed it in the last month or two being out there. So let me just show you the article I have about Dapsone where I review some of the science on it. All right, so take a look at my chapter on persisters. Where is it? Oh heck, let's do it up here. We'll do Dapsone. Okay. So this is my review of Dapsone, where I break down some of the Horowitz data I was just telling you about. I even talk in here about the 200 milligram dose, but I do describe the difficulties of taking this medication. Okay. Excuse me, everyone, just a minute. And actually, Jen, I'll go back and after this webinar tonight and see if there's something that just recently got released that I missed. Okay. All right. Hello, Patricia. Hello, Dr. Ross. Thank you for the time and energy you put into these podcasts. Ill for 5 years. You're welcome, by the way. Ill for 5 years and currently treating for mold with Welchol and NAC plus various support supplements. Main symptoms are neurologic, severe brain fog, memory, vision, sleep imbalance. A previous IGenex study shows Lyme not active but positive for Bartonella. Report reads babesia fish with blood positive, Bartonella Western blot IgM serum positive. Let's see here. And your Bartonella Western blot IgG is negative. My current doctor does not trust IGenex for Bartonella and wants to do Galaxy. What is your opinion? Also, your opinion on synapsin. Thank you. All right. All right. So in terms of testing for Bartonella, and actually I need to update my article on how to diagnose Bartonella to put some more comments in about testing. So there's two major tests that you can do out there at this point that have some reliability. One is Galaxy Labs. And Galaxy Labs is doing a PCR test, which is a DNA test. It's looking to see, do you have the DNA of Bartonella in you? And they can actually look to see if you have Bartonella of the 15 different strains that are known to infect humans, okay? So theirs is a DNA test to see if the germ is in you, and they can identify up to 15. All right. That sounds great. All right. The Western blot technique that IGenex has is something they developed over the last year or two that looks to see, is your immune system making antibodies against Bartonella? Okay. So the PCR test says, is it really in you? We're looking for parts of the germ in you, the DNA of the germ, okay? Versus the IGenex test is asking, do you have an immune reaction against it? Are you making antibodies, okay? Now, the Western blot technique, through one of the problems we've historically had with Bartonella is antibody testing, like doing IFA testing is another way you can do it. Traditionally only looked to see if you had antibodies against 2 strains, and those were Bartonella henselae and Bartonella cantana. But again, as I said, you can have that we now recognize there's up to 15 kinds of Bartonella that can infect somebody, right? So IGenex has been trying to figure out what to do with that, with their antibody testing. And what IGenex is doing with their antibody testing is they now look to see, do you have antibodies against the whole family of Bartonella? And within that family, they can specifically identify 4 of those family members, all right? So for instance, if you get a positive antibody test against the family, but are negative on one of those 4, you'll still be reported as positive, but it just won't say that you have one of those 4, meaning you probably have one of the other 11. Okay, now, so in theory, both Galaxy and IGenex can pick up Bartonella, all 15 kinds. The Galaxy test can identify each of the 15 versus the Western blot through IGenex can identify the family. And within that family, if you happen to have one of the 4, it can identify those 4. But by identifying the family, it really can pick up all 15. All right? All right. So what they can pick up, they all can pick up pretty similar things. Galaxy versus the Western blot through IGenex. Okay. Now, here's where the rubber hits the road. The problem with the Galaxy test is that you have to be able to capture blood that has the Bartonella swimming by it when you draw the blood. And Bartonella lives in a lot of places, and most of that is not in the blood. So the way that Galaxy works around it is they have you do a triple blood draw, where you get blood drawn one day, you go back another day, and you go back another day. All right, so you do 3 samples. The problem with their testing, though, is when we look at their own validation studies where they've gone out to see how effective their test is, their validation studies do show that when you test positive for the germ, you actually have it. All right, so it's valid in that sense. All right, you don't get false positive test. But to do validation about how good your test is at picking up all people that have Bartonella, you would need to get a whole group of people known to have Bartonella and use the Galaxy lab test to figure out, can it find the Bartonella in all those people? And that type of study has never been done. All right. That ability of a test to find a germ in you is known as sensitivity. And the truth is, we don't know how sensitive the Galaxy lab test is. We do know that when it does come back positive, it really means you got it. But we don't know, does it pick up 40% of cases? Does it pick up 80% of cases? How good is it at doing that? We just do not know. There's just no data that shows that. Galaxy has never done. I've actually talked to them. They don't have that data. Okay. Now, the Western blot through IGenex, and I'm going to just talk this roughly off the top of my head. I believe that their sensitivity is around 90%, meaning they've done validation studies to see how accurate, how good is it at detecting Bartonella if it's in you based on antibodies. And I think it is probably pretty sensitive, okay? Probably, all right. So the way that I've been doing it, I'm now switching more towards using the, if I want testing evidence, I am switching over to doing the Western blot through IGenex. And if that's negative, I still have a strong sense it's Bartonella I'm going to treat. But if I've got somebody that wants lab evidence they have it, if the Western blot comes back negative, somebody still has a lot of symptoms, I may then try to do the Galaxy test, okay? My sense is the IGenex Western blot, which is an antibody test looking to see if you have antibody reactions, which is not dependent on the germ swimming by the needle right when you draw the blood. That's not dependent on it, okay? That the Western blot test is better at picking it up than what the Galaxy test is, okay? All right. I hope that answers your question. It's a very confusing topic, I know. All right. In terms of synapsin, I think you're referring to the polypeptide that is being used or the protein that's being used. It can help with neurologic function in the brain in some people. We don't have any data that says what percent of Lyme people get help by using synapsin. All right. I know. So anyhow, that would be my comment on it. I think it's worth a trial. I don't know that it works that well in most people, actually. Okay. All right. Thanks for that question, Patricia. Hello, let's see, Joanne, let's see. Thank you for conducting these webinars. I had two questions. Have you seen strange symptoms where speaking creates teeth pain due to vibrations, or so it appears? What is your opinion on what is causing this? And two, could this be central nervous system Bartonella? Want to understand if and how it can be fully eradicated. All right. So I haven't seen that specific type of symptom occur in any of my patients. It does sound like some type of a neurologic irritation, and the two germs that might be able to give that kind of neurologic irritation would be Lyme and or Bartonella. All right. So those would be my thoughts on that. Okay. All right. Hi, Laura. Laura says, cute dog. I don't know if many of you saw earlier tonight, one of my two Basenjis. I bring two dogs in here. Here, I'll show you what a Basenji looks like. Hey, Thor, come here. Come here. Come on. All right, so two of these guys. This is Thor. Thor is one of my Basenjis. That's who was hopping around earlier there tonight. And Thor has a sister named Halo. And so they both come to work with me and see patients. So this, I think it was Thor that you saw hopping around there earlier tonight. Thor, give him a profile. There you go. That's Thor. Okay. All right. All right. Thanks, Laura, for that comment. I appreciate that. And the reason I didn't show you Halo is she is sound asleep below my desk right now. So I'm not going to wake her up. All right. Hello, Michael. Hi, Dr. Ross. My name is Michael, and I have a 14-year-old identical twin son. At the age of 8, Heath was first diagnosed with Lyme disease, and for approximately 3 years was treated with IV antibiotics, and then shortly after with IVIG. Through this time period, he made some great improvements. My wife and I were slowly getting our son back. Unfortunately, approximately a year and a half ago, for some unknown reason, Heath suffered a relapse. Keep in mind, Heath has had numerous MRIs and spinal tap, all showing normal results. My son is currently 14 years old and recently tested positive for Bartonella, babesia, and high mast cell through IGenex and Galaxy, all under the care of a pediatric Lyme neurologist in New York City. During the setback, Heath has been walking on his knees everywhere he goes, not standing or talking. He has separation anxiety, OCD type behaviors. Heath is currently taking IV antibiotics consisting of Mepron, Rifampin, and Zithromax. Improvements have been minimal. My question for you, do you feel we are on the correct track? And if so, typically how long on IV antibiotics before significant results? Would you be recommending some other therapy like plasmapheresis or some other supplements? Have you seen these severe symptoms before with Lyme? Have you heard of IVIG causing loss of speech due to overload of anti-neuronals? So, Michael, this is too hard for me to answer in this kind of a setting. It's a complex situation. And although he tests positive for those germs, I would want to make sure there isn't something else going on here. It is possible, and it sounds like he'd be getting a reasonable treatment there. But I also would want to make sure there isn't something else triggering this too. What else could trigger? Well, people can have big declines if by having been on antibiotics, they get too many yeast in their intestines. And I know it may sound like a far-fetched, but what happens if you get too many yeast in the intestines? They trigger cytokine excess. Cytokines lead to mental health problems. In addition, too many yeast in the intestines can release toxins that can act as neurotoxins. All right. In my practice, 80 to 90% of the time that somebody comes in with something that looks like it's a relapse, I find if I treat yeast, that they will get back to normal within about 4 to 6 months, and we never have to go back to antibiotics. And even in an extreme situation like this. So I don't know because I don't get to ask you a bunch of questions in this format, but something to consider is, could you have too many yeast? The other thing I would be looking at, given that he had done well for so long and then suddenly had a demise, is what else is triggering that could give you neurologic problems like this and increased cytokines like this. And that would be mold toxicity illness. I would be looking to see if there's mold toxicity here too. But in the end, it may be that you're doing the right thing working with the New York City doctor that you're working with here, okay? If you would really like my input more, because this is complex, I'm giving you possibilities here, you could set up a consult visit with me where I'd give you a better opinion, but I would need to ask a lot of questions and review data, etc. Okay? All right. So if you're interested in doing that, and this would be for anyone that might have interest in visiting with me, let me just do a quick screen share here for you. All right. So if you are interested in that, take a look at my clinic here. And this is my clinic. It's Marty Ross MD Healing Arts. Take a look at my appointments page. Read about the possible appointments I have. I have a full medical service or something called limited consult service. You'll find details about both of those visits down here. Read through everything because it probably answers your question. And if you read through these sections and it doesn't answer your questions about cost, insurance, etc., then take a look at my frequently asked question page up here. But in the end, after you've looked at all that, if you want to book the appointment, you can book it here. It's an online appointment system. Okay. All right. Thanks for that question. Good luck to your son. Hello, Ryan. Let's see. Hello, Dr. Ross. What do you think of the recent study? I'm going to have to look and see. I know you're the second person writing about this. I'll have to look and see if he has released a new one or is it just a republication of some of his old stuff. So I'll have to look at that. Hello, Mary. Let's see. Hi, Dr. Ross. What is the best test for detecting mast cell? So, Mary, so mast cell, everyone, mast cells are the allergy cell. All right. So they're where histamines are made. And if you're allergic to something in your environment and it lands on a mast cell, and then you get the histamines release or the mast cells release histamines, and that causes a bunch of problems. Okay. All right. Now, we also know, though, historically, we've only thought mast cells could be turned on and activated by things you're allergic to. We now know, actually, that having chronic infections and having mold toxins in you can trigger mast cell overactivity as well, too, so that the mast cells more easily release their histamines. So we start thinking of somebody as having mast cell activation when they have a lot of allergic type symptoms. So that can be skin rashes, flushing, hives, could be a lot of nasal allergy problems, might be asthma getting really bad, or the person that starts reacting to every food in the world. Okay, you got to start thinking about mast cell activation with that, all right? Most of the time, mast cell activation is actually a diagnosis you make clinically. The reason is the testing we have is just not that accurate. So the testing you can do would be things like PGD2, you can get histamine levels, you can measure something called tryptase. There's a number of tests you can do, but often, even if you're having a full-on raging symptom episode of having histamine excess, these tests will be negative. So most of the time, I'm going to rely on clinical grounds, okay? Now, I'll show you an article you can read about the various testing and how to diagnose it and what to do to treat. But those would be my general comments on that, okay? All right, so take a look at let's see here. I'm just blanking on what I was going to show you here. Oh, that's right, mast cell activation. Take a look at my immune section here and take a look at this article on mast cell activation. And I review the various symptoms you might have as part of this. And I talk about the tests being poor, but if you're going to do them, tryptase, histamine, prostaglandin D2, heparin is one that I forgot about, okay? And I review in here, how do you go about treating mast cell activation syndrome too? All right. Mary, thanks for that question. Hello, Sherry. Let's see. Hi, Dr. Ross. Thank you for your valuable help. I've just started the protocol for BART and Rifampin, 2 pills twice a day with azithromycin and oregano oil. Should the oregano oil be taken with food? I have had constant balance issues and not sure if this part of BART, but I am hoping this protocol helps. I am testing for mold and Great Plains labs, but have no results yet to see if this is perhaps the cause. All right. So Sherry's doing a protocol that I recommend for treating for Bartonella. And that is, we now recognize based on studies that were published in November of 2019 and I believe April of 2020 by Johns Hopkins University, Dr. Ying Zhang's lab, that Bartonella also has the ability to have a growing forms and persister forms. Persisters would be hibernating forms, okay? In the more recent study, the April study, his lab showed that oregano oil, in the more recent study, the lab showed that azithromycin and rifampin are 2 of the strongest antibiotics we can use for growing forms of the germ. In that study in April, also, he showed that methylene blue is very useful for treating persisters. Other research that lab has published over the last couple of years shows that oregano oil is also very useful against persisters. And there's a body of science that shows that oregano oil is also useful at breaking up biofilms of various germs, okay? So I like using oregano oil for my biofilm breaker for Bartonella and also for treating persister forms. In terms of when to take it, you can take it with or without food. I don't find any difference either way. Okay? All right. Good luck to you. Hi, Crystal. Let's see. Hi. If genetic test results show a person should take folinic acid, would folic acid be toxic to them? I am preparing to do Dapsone treatment, and leucovorin is extremely expensive here in Canada. Could I use folic acid instead? Thanks, Ken. Yes, you can. No problem at all. Hello, Laura. If you need more questions, the pain specialist at Pain Clinic in Halifax, Nova Scotia, took Rebecca off all her treatment meds for tick-borne diseases, including disulfiram, because she said that it was the drugs causing all her symptoms, not Lyme. She's getting even sicker and sicker, especially brain fog. Any ideas or thoughts that could help her deal with the pain doctor? You know, a pain doctor obviously is of a viewpoint that there isn't something called chronic Lyme and that treatment doesn't help. And I don't know how to convince the person otherwise when they get into that kind of a mindset. So I'm sorry, I don't have any decent way of dealing with the pain doctor. Good luck to you. Good luck to your daughter. Hello, Joyce. Hi, Dr. Ross. Thank you for everything you do for those of us navigating Lyme, etc. I'm taking ATP 360 for nerve pain and muscle issues. I slowly rampled up to capsules per day. Is there a best time of day to take this? I have been taking them an hour or two after dinner and have recently noticed the following: a burning stomach, a problem I thought I had initially conquered, increased issues with sleep, and finally an odd pressure in my head. Aside from vitamins, I am also on Cytokines, Hutanio, Cat's-Called Banderol. I truly appreciate your time. Joyce, you could try taking those with food, and it's 3 pills 1 time a day on the ATP 360. Everyone, ATP 360 includes the fats that we use to repair your cell energy factories called mitochondria. It repairs the covering. ATP 360 also can be helpful for repairing injured nerve cell membranes as well too. Okay, and I like using it as 3 pills 1 time a day. You can take it with food if it's causing upset stomach. If it seems to be keeping you awake at night, try to move it into the morning and see if that will make a difference for you there too. Okay, all right. Thanks for the question, Joyce. Hello, Doug. I see I started taking Biocidin yesterday and I'm experiencing severe brain fog. I'm also taking Septin or doxycycline. Oh, I think I answered that one earlier. Hello, Beverly C. Can Lyme be sexually transmitted? The answer is probably, but the chances I think are small. And I know that's a lot of inexactitude there, but let's talk about it. So we don't have great science here. That's the problem. If I look at my own practice, I have a number of patients that partnered patients, male-female patient partners, where both have it, and I tend to see it at a higher rate of both couples having this illness than I might expect. And that has me wondering, could it be sexually transmitted? Okay. Now, I will say that not both couples and everyone when I have people that are partnered, most of the time the other person doesn't have anything that looks like Lyme. Okay, so I think it's a small percentage of the time it could be if it is. All right, so what do we know from science? So science, there's been a couple of research projects done looking at, can Lyme be in the fluids of people that have it? Can it be in the sexual fluids? So is it in the male ejaculate? And does it show up in the vaginal fluid of a female? Okay, so in one of the studies, these are 2 studies that were done that essentially looked at the same question. In one of the studies, 50% of the men that had Lyme, it showed up in their ejaculate. And in that same study, 100% of women that had Lyme, it showed up in their vaginal fluid. The other study that was done, pretty similar study, had the reverse effect. It showed up 50% of the time in the vaginal fluid and 100% of the time in the male ejaculate. Okay, so we know it can be in the fluids. But keep in mind, just being in the fluids doesn't mean it gets through all these barriers and protections in the immune system, your immune system's ability to deal with it. Okay, all right. So then you can, if you Google about Lyme and sexual transmission, you'll run into an article that one of the authors was Ray Stricker, who's a physician out of San Francisco, and it's really not a good study. but Dr. Stricker did a great job at the time of publication of promoting the idea that I think he even said something like, we have more to fear in our bedroom than we do in our backyards, which is just absurd based on that study. And here's why. So it's a poor study. It's a poor quality study. All right. So they looked at 13 people. I'll let you know, in medicine, we never can make solid conclusions on any study with that small of a group of people. Okay, so that's first problem. It's too small of a study to make any generalizations. In the study, what they did is of the 13 people, the men and the woman, they swabbed their vaginas, and then the male, they looked at the male ejaculate, and they were able to detect specific strains of Lyme. And it so happens that in the study, there were 6 people, of which there were 3 partners, 3 couples, I should say. And of the 3 couples, both the male and the female both had identical strains of Lyme. So they took that as some proof that it can be sexually transmitted. But there's a big problem here with this study. So in addition to it being a small study, they did not tell us how long it was that the men, that it had been with the last sexual activity. In other words, when did the male last deposit sperm and his Lyme germ in the female? That wasn't controlled at all. So when we're measuring female's vaginal fluid, we want to know, does it come from her into the vaginal fluid? And if it does get into the vaginal fluid and it's from her and it's the same exact strain as the male, then you could say, yeah, maybe they're sharing the same strains back and forth. If it got into her vaginal fluid and the male had not ejaculated in her for 2 weeks, for instance, we know that the germ that they're measuring came from her leaking from her blood into the vaginal fluid. All right. But if the male had just ejaculated a few days ago, maybe what they were measuring is not Lyme that had leaked from her into the vaginal fluid, but rather Lyme that was deposited by him into her vaginal fluid. And again, just because he deposited it in her vaginal fluid does not mean that is going to get through all of her defenses to infect her blood. All right. So it's a horrible study. I don't know what it means at all, actually, other than they showed that it can be in the fluids again. Okay. So I caution you because you'll run into that study and it's just horrible. I think that Lyme, based on my clinical experience, can be sexually transmitted. I think it occurs in a very, very small percentage of the time, though. I think most couples that have Lyme, probably it does not transmit back and forth. All right. Thanks for that question, Beverly. And good luck to you. All right, let's see here. I think I'm going to call it for tonight here. So it's about 5:28 here, and I'm feeling kind of worn from my day, and so I'm going to move on here. I've got to get 2 Basenjis out for an evening walk, and I've got to even exercise myself too. So it's been fun being here with you again tonight. I will take some time this evening to edit the video and get it ready to send to send you information tomorrow morning, your email saying it is ready to be viewed, okay? When you get that email tomorrow, sign up for next week's webinar. There'll be links in that email to do it. And also feel free to share what we're doing here. Share the email. Let other people see about these webinars and let them sign up for it as well, too, if you think they might get some benefit from it as well. All right? So good night, everyone. Nice to visit with you again tonight, and look forward to seeing you all here next week. Bye-bye.